This is WFYI News Now. It's October 11th, and I'm Abriana Herron. On today's show, Indy's animal shelter is working to reduce capacity, which has been critical for years. Republican gubernatorial candidate Mike Braun proposes a series of policies aimed at public safety. And we'll talk to a researcher to help answer a complicated question: what makes a protest effective?
Saying I want justice for a particular issue isn't enough.
Those stories coming up. But first, the next installment of our regular segment called The Checkup from Side Effects Public Media, where the health reporting team explores a single question sparked by a recent news story or maybe by one of our listeners.
Much has been made of Project 2025, a nearly 1,000-page blueprint for if former President Donald Trump were to win the upcoming election. It's authored by conservative think tank Heritage Foundation. Democrats have worked hard to attach the plan to Trump's campaign, while Trump himself says he has no connection to the plan. The Checkup's question today is, can Project 2025 tell us anything about what a new Trump administration might do with Medicaid, the public insurance program for low-income adults? I'm Lizzie McGreevy, Side Effects Public Media's Community Engagement Specialist, and I'm joined today by health reporter Ben Thorpe.
Hey, Lizzie.
Hi, Ben. So can you start off by talking about what Project 2025 might tell us about how a new Trump administration might handle Medicaid?
So Project 2025 is a huge plan that has eaten up a lot of political discourse and contains a range of conservative wish list items, everything from abortion to immigration to Medicaid. Trump himself has said he has no connection to the plan, which you mentioned at the top. And I think it's good to also mention that a Trump administration's ability to pass many of these policies is going to depend on the makeup of Congress after the election. I also think it's worth taking just a step back to offer some history here. The 2010 Affordable Care Act expanded Medicaid to non-disabled adults under 65. And to incentivize states adopting the expansion, the federal government agreed to match states for 90% of the cost of services to that new group. Now, Project 2025 talks about reforming financing for Medicaid in really vague terms, calling for a more balanced or blended matching rate and the use of things like block grants, which can essentially cap how much money can come to a state for Medicaid. Experts I spoke with say that kind of language is essentially amounting to a cut, either to services or to the number of people who will ultimately be covered.
Ben, we've heard about cuts like these before. Correct me if I'm wrong, but wasn't the Repeal and Replace movement led by House Speaker Paul Ryan back in 2017 aimed at doing something pretty similar to this?
You are exactly right. A lot of this is not new. Listen to what Edwin Park told me. He's a researcher at Georgetown University McCourt School of Public Policy.
This proposal in Project 2025 is no different than what's commonly included in leading Republican conservative health plans, going all the way back to Paul Ryan's budget plans, efforts to block grant, all the way back to Ronald Reagan in 1981, Newt Gingrich in 1995, and so forth.
Why are so many conservative plans aimed at reducing Medicaid spending?
Well, it's worth understanding that Medicaid, Medicare, and Social Security spending make up about half of the federal budget. So if you're looking for places to cut, it's obviously up there. I spoke with Brian Blais, a former Trump advisor and president of the conservative Paragon Health Institute. The institute recently released its own plan, which includes more explicit steps to phase down federal matching rates for Medicaid spending. Conservatives like Blais say those drawdowns are necessary because the federal deficit is growing and because of what he describes as abuse of Medicaid funding models.
My view is that Medicaid, it's a program for low-income Americans. It's a welfare program. It should not be a cash cow for the healthcare industry.
And what do progressive policy folks have to say about this?
So I spoke to Allison Orris. She is a senior fellow at the Center on Budget and Policy Priorities. She said the idea that states aren't paying attention to Medicaid spending because the federal government is picking up a big chunk of the tab just doesn't make sense to her.
That's where I think, the conservative vision is really different, and that a lot of these proposals are, focusing on taking coverage away from people. Even if they're framed as reducing federal costs, or cleaning up program integrity or, whatever the argument is.
And Ora says the kinds of policies that are being talked about, including block grants or changes to Medicaid matching rates, could result in millions of people ultimately losing their coverage.
Ben, thank you so much for taking time to talk with us today.
Always a pleasure, Lizzie. And
Ben and friends, just a reminder, elections are on November 5th, and you can find voter guide on election races on our website at WFYI.org.
That was The Checkup by Side Effects Public Media. Side Effects is a regional health reporting collaboration of NPR member stations across the Midwest. It's based here at WFYI. Indianapolis's animal shelter is working to reduce capacity, which has been critical for years. WFYI's Jill Sheridan attended a recent animal adoption event to get an update on efforts and other changes for Indianapolis Animal Care Services.
Dogs in crates line a large warehouse on Indianapolis's northwest side. Tiffany Palmer and her family are adopting Webster. She says rescue animals are important.
Our main love is for pits. We take anything with fur and 4 legs, but we really kind of connect with pits. Feel that they're a little misunderstood, and they're great dogs.
Overcrowding at the current facility has been an issue, but IACS Deputy Director Kelly Diamond says it's getting better.
If you've been to our shelter, you've seen like the hallways lined in every office and, our front adoption lobby. We have no more crates with dogs living in them.
The shelter has limited intake for about a month and set up a new population management plan that aims to keep capacity around 80%. The new city budget recently approved a measure that makes IACS its own agency with more than $1 million in added funding. I'm Jill Sheridan.
Republican gubernatorial candidate Mike Braun is proposing a series of policies aimed at public safety. As Indiana Public Broadcasting's Brandon Smith reports, they include increasing criminal penalties and improving access to mental health care resources.
Braun proposes harsher sentences for people who deal what he describes as lethal drugs like fentanyl and meth. At the same time, Braun wants to continue investments in drug prevention and recovery while also allowing more telemedicine in mental health care. Braun's proposals would pour more money into state police salaries and law enforcement training. The Republican also wants to protect qualified immunity for police, which largely shields law enforcement from lawsuits. Braun received backlash years ago for his proposal to reform qualified immunity in the wake of the murder of George Floyd, which he quickly dropped. Braun says he would also involve more state resources and personnel in helping federal authorities enforce immigration laws, which includes continuing to send National Guard troops to the border in cooperation with border state officials. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
And for our final story today. Over the past decade, the U.S. has seen several large protest movements advocating against things like racial injustice, sexism, gun violence, climate change, and even vaccinations. But what makes a protest effective? Indiana Public Broadcasting's Rebecca Thiel asked a Michigan State University researcher.
Associate Professor Danielle Brown researches social media and journalism. She says the first step of an effective protest is to find like-minded people, then come up with a clear message and concrete solutions to the problem. Brown says an effective protest often demands attention by interrupting people's day-to-day lives, like blocking the road. It's not always popular and sometimes illegal.
But the reason that protesters engage in that is because saying, I want justice for a particular issue isn't enough. Because many protests start with, we've brought this to our legislators' attention. No one is hearing us.
But Brown says protesters need to make sure the goals of the event don't get lost in the spectacle, which is why making connections with journalists is important. Even more importantly, Brown says to recognize that change takes time. For Indiana Public Broadcasting, I'm Rebecca Thiel.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back on Monday.